Hi, Shine community. I want to take a few minutes to talk about malassezia, seborrheic dermatitis, and its potential role in neurological disorders, based on an article that I read over the weekend where they talk about malassezia, this common commensal yeast. Its DNA is actually identified in the brains of some people with neurological conditions like Parkinson's. What we know is that seborrheic dermatitis is an inflammatory condition of the skin. It affects the sebaceous, the oily areas on the scalp, the midface, the chest. And we know that it's very tightly linked with overgrowth of this commensal yeast called malassezia. Um, Even though it's tightly linked with neurological diseases, especially when it's much more severe, how that relationship is and the directionality of that relationship has always been a little bit unclear. This article by Dr. Doss and team, published in Molecular Neurobiology, discusses a curious perspective. The team points out that malassezia DNA is identified in the brains of many patients with neurological conditions and seborrheic dermatitis, and they hypothesize that malassezia and fungal imbalances may be a direct cause of the neuroinflammation and degeneration seen in these patients. They discuss how malassezia can cross a leaky gut and enter the brain through the blood brain barrier, where it can cause problems due to its lipophilic nature and ability to form these little microvesicles. Maybe seborrheic dermatitis and malassezia on the skin is less benign than we've been taught. Maybe it's less of a consequence and more of a cause of neurologic disease. And maybe it represents a red flag that we really need to pay attention to, that our fungal microbiome specifically is out of balance, and it gives us an opportunity to intervene before neurological changes can take place. Our skin is always telling us something, and we need to pay attention.